If I was a flower growing wild and free, all I'd want is you to be my sweet honeybee. And if I was a tree growing
Before there were hospitals, many babies were born at home with the help of a midwife. However, things changed in the mid-70s. Alabama made it illegal for midwives to attend home births, and those who ignored the law could face prosecution. Alabama is one of about 13 states in the country that prohibits midwives to attend home births. It wasn't always that way. Up until the mid-70s, midwifery was completely normal in rural Alabama.
The Alabama Code, Chapter 19, is a policy that keeps midwifery legal in the state of Alabama. The manifest goals of this policy are to ensure safe pregnancies as well as limit potentials during birth. The latent goals of this policy are to keep the majority of revenue in hospitals. This policy affects women of childbearing age, their families, and midwives of Alabama. This policy denies women the right to personal choice.
Midwifery is a healthcare profession in which providers offer care to a childbearing woman during pregnancy, labor, and birth, during the postpartum and between pregnancies. There are two kinds of midwives, a certified professional midwife and a certified nurse midwife. A certified nurse midwife has a bachelor's degree and is a registered nurse. A certified professional midwife has a college degree and receives special training.
While doing a phone interview, Karen Coleman provided information about midwives. Coleman, who is a CPM, is licensed in Tennessee and has been a midwife for 30 years. While talking to her, I asked her a couple of questions about the type of training that midwives do, how the clients pay, and the pros of choosing a midwife over a doctor. Coleman says that the type of training that midwives do is an apprenticeship program or online courses. She also likes the hands-on approach. Clients pay through insurance and cash. She charges $3,000 for her services. She says that the reason why women choose midwives over doctors is because they prefer the natural birth, the whole idea of being natural.
Hi, could you tell us about your experience with midwives versus the OBGYN and why you prefer midwives?
Well, when I was pregnant with my first child, I lived here in Alabama and I was much younger. I was like 22 when I was pregnant with him, and I didn't really know much. I wasn't very informed about birth or anything to do with it, and I was actually very afraid of pain. So I feel like even if I had a lot of options, I probably still would have chosen a doctor and a hospital birth. But after I went in, I got induced because I was tired of being pregnant and for no other reason, and they went along with that, and I went into the hospital, and when I got in there, it was just an experience that was completely outside of my control. It was like I had no choice in anything. Everything was, this is what's going to happen. You have to follow the. So for my second one, I was like, I do not want to have a baby in this state because it's illegal in this state to use a midwife. It's illegal to have a home birth. So the only option that I was aware of was just having a baby by yourself, which is not ideal for me, like in a bathtub or something. And there's a strong movement for that, but I think it's nuts. So we just decided that was sort of pushed us into moving to Seattle quicker than we should have, realistically. And so we went up there where it's totally legal, midwives, home births, the whole thing. And that experience, the care was very different. Like, you know, doctors, you go into the office for like if you're there for an hour, you see the doctor for like 3 minutes. And the rest of it's nurses in pea cups and sitting in a room in a gown, and that's all it is. Midwives, it's like none of that. You're there for 45 minutes straight with a midwife, no one else. There's no nurses or any of these other peripheral care people. And I mean, you're talking not just about your pregnancy and your medical symptoms, you're talking about how you're feeling and your needs. They ask me a lot about like, how are you on food and are you safe? And like, I mean, like during the first interview, like my husband was not even allowed to be there because they wanted to like go over safety and things like that. I mean, it was just like really holistic care. It was very, very, very client-centered, whereas the medical model is very doctor-centered. Like they manage your birth, and you know, it was just the attitude, the vibe with midwives was so completely different. Like they don't even say they deliver babies. I don't know how much research you guys have been doing into that, but they don't call themselves, you know, the deliverers of baby. They say they call themselves baby catchers because they think mothers deliver babies. So I mean, like they just have a completely different attitude about it.
What was the name of the agency that you went through?
Seattle Home Maternity Services. They did both birthing center births at their agency, and they also go out for home births.
Was the midwife that you used licensed?
Yes, in Washington it is illegal to operate without a license, and Yes.
What kind of midwife?
She was a CPM, a practical midwife. I know that there's a lot of different kinds, but those are the kinds I prefer. Because the CNMs, very medical model, very medical approach, or the certified nurse midwives. Not for me.
So what was the benefit of having a CPM?
The CPM does go through the training of, they all go through different trainings depending on the program that they go through, but the certified nurse midwife is always, not always, but usually going to come at it from a medical perspective, which is risk assessment, and they're also going to have that I'm in charge, in my opinion. There are plenty of people who love having CNMs and they like to have the sort of more medical home birth or birthing center birth or whatever, but I don't. I don't want any of that. I don't want your baby could die if you don't. That's just not necessary. And I don't like people who really want to get in there and manage and make decisions and things like that. And I feel that CNMs are more inclined to do that, whereas CPMs, they're just much more client-centered. Birth choices, because literally in this state there's basically one birth choice that you can make. There's no others. And there's a lot of info out there on birth outcomes for poor people, for people of color, for people, in rural environments, like home environments. It's just the one birth option thing is not acceptable. And there's really, the only thing that is standing in the way of birth choices, in my opinion, is that fear culture.
For more information about our cause, go to alabamabirthcoalition.org, check out the documentary on Netflix, The Business of Being Born, and be sure to sign our petition. Thank you.
Free, all I'd want is you to be my sweet honeybee. And if I was a tree growing tall and green, all I'd want is you to shade me and be my leaves.